The National Assembly is in the news again, this time over allegations of drugs and equipment diversion in its staff hospital. Jonathan N.D.A. Isaiah, in this piece, captures the ugly situation. What do arms of government's hospitals have in common these last few weeks? Drugs diversion, scarcity of drugs and lots of scandals. 2 months ago, the State House Clinic was trending as allegations of scarcity of drugs hit the hospital. The State House Clinic caters for the president and his family and staff of the villa, and also their families. The wife of the president, Aisha Buhari, at an event called out the permanent secretary of the State House and the managing director of the hospital over lack of drugs in the hospital. This time around, the National Assembly Clinic is in the limelight, albeit for the wrong reasons. It is instructive to note that the health sector in Nigeria is in a comatose state. In successive years, there has been no improvement in the health sector in the country. Most of the hospitals have turned to mere consulting clinics. Lack of access to quality health care, coupled with the prevalence of quack doctors and poorly equipped hospitals, fake drugs and substandard products are bane of the health sector in Nigeria. It is sad to note that Nigeria is losing their experienced health workers to developed countries as a result of neglect of the health sector, mismanagement of resources, lack of priority, lack of respect for human lives by the leaders, low wages, poor motivation, persistent shortage of basic medical supplies, poor working conditions, outdated equipment, lack of efficient and effective coordination, limited career opportunities, and above all, economic reasons, are among the most important factors responsible for this brain drain. Suffice to say, the huge budgetary allocation to the legislature was expected to translate to world-class services and equipment in the National Assembly Hospital. The National Assembly Clinic caters for lawmakers, their aides, and families. N$125 billion was allocated to the National Assembly in the 2017 budget. In the breakdown of the National Assembly 2017 budget, Senate and the House of Representatives are to receive N$919,065,013, $31,398,765,886 and $49,052,743,983. Other appropriations under the National Assembly are as follows: legislative aids, $9,602,095,928, NASS Service Commission, $2,415,712,873, PAC Senate, N118, $970,215, N142, $764,258, General Services, N12, $584,672,079, NASS Legislative Institute, $4,373,813,596, and Service-Wide Vote, $391,396,169. It is worth emphasizing that the National Assembly Clinic in its present state cannot cater for legislative aids, talk less of the principal officers of the National Assembly. Leadership checks reveal that the hospital has recorded malfeasance, including scarcity of drugs, disappearance of medical items which are allegedly diverted to private pharmacies. Despite the budgetary allocation to the hospital, the clinic is gradually becoming a shadow of itself. A staff who spoke on condition of anonymity narrated the level of stress she had undergone, as a result of lack of doctors and equipment to work with it. She said, "Doctors are hardly enough.